To the first ever episode of the Roads Home Healthcare podcast. I've wrestled with this back and forth. I didn't know if people wanted to hear from us, but you know what? You have no choice in the matter. You're going to hear from us. Just a little background. My name is Andy Hernandez. I started the Roads in 2016. I actually acquired the Roads in 2016. I had 7 patients, and my sister was my partner in the business along with my brother. And now we grew it to over close to 800 patients in the state of Florida. We have sister company. So it's really, we're serving about 1,000 patients in the state of Florida. And there's a lot of challenges that go on in our business, and home health is something that's really needed in the community. And I think we need to start educating people on exactly what it is that we do every single day and the value that we provide to our patients and to the community and to our partners, right? And there's a lot of conversations to be had in this business. It's had a lot of challenges. There's a lot of conversation about the fraud that's going on in California right now. And this is nothing new to us. If you have had a business in healthcare in the state of Florida, you understand that fraud has been happening for a very, very long time, and that the feds have been down here and they've cleaned everyone out. And there's only so many of us standing still. But we are here. We are here to continue to provide services to our patients, to provide the best possible outcomes to them. And we've survived all the bad that's happened in our industry. There has been a lot of challenges. The government has cut back a lot of our revenue, and it's made it a lot harder to navigate in the current system that we're in. So we're going to be having these healthy conversations. So today I have Ruben. He's our RSM, our Regional Sales Manager in West Palm. And we're having conversations, and we really want to highlight the impact that the roads has on us every single day. We want to bring out our culture and what it is that we do. We've developed many account executives that have had very successful careers, and they've started here with us, and it's been their first job in healthcare, and we've been able to help them grow. And some of them have gone on to other opportunities, and I've seen them excel. And I like to think that we were a big part of the foundation that we created in this business for them. So we had a conversation. We're like, well, let's just start creating content for the roads, and this is our first podcast. So welcome to the show, Ruben. How do you feel? I know it's your first podcast ever.
First podcast ever, the hardest pumping, but I'm ready to rock and roll. It will be as it shall be. So I'm excited about this.
So let the audience know, how did you start in healthcare and how did you end up with us?
So my first love was biology. It was my favorite subject. I started in pre-med, but I finished graduating with business degree. Then I realized that I could merge my degree and my passion into sales, medical sales. My first role ever was in surgical sales. It was an internship, and I fell in love. I did total hip and knee surgeries. I was responsible for the implants, the instruments. I learned everything that there was for those operations. Then I jumped into pharmaceuticals. Pharmaceuticals, yes, it's a big and great world, but a lot of those pills have a lot of negative impacts on humans, and I would never prescribe them after the trainings to any of my family members or loved ones. Which led me to physician-to-physician sales. I represented a vascular surgeon, and I brought him business. That brought me joy because vascular needs, you can't avoid them. That led me to DME for urology equipment. I loved it every moment. Became one of the best. My nickname was the King of Baltimore. I was in charge of 2 states, Maryland and Delaware, and was lucky and blessed to have the opportunity to finally be given the chance of leadership within the roads, home health, and now managing the Northeast, as I like to call it, West Palm Beach and up, all the way up to Sebastian. So
amazing.
Here I am today.
So talk about, you've gone from sector to sector within the industry. How does home health compare to all those sectors?
So home health, again, it's from all of the sectors, I would say it's my favorite because home health is something that patients need. You can't avoid it. Right. And especially today, and especially where we live in South Florida, it's megatropolis for home health need. And there's a word floating around town, the silver wave. The silver wave is coming. The baby boomers are coming of age, and no longer are people taking care of their parents like they did back in the day. They either live very far away or it's just simply not part of a social construct or the way that things are. So there's a very great need for home health. Skilled nursing facilities, assisted living facilities are blowing up left and right. We're here to serve. We're here to take care of those people that need to get taken care of. One day I'm going to be in their shoes. I'm trying to train my kids now at an early age that when they grow up to take care of mommy and daddy and for us to move in with them. But we'll see what their wives think about that. So, home health. It's a necessity
Absolutely.
and it's a joy.
Yeah.
So
So you brought up
warms the heart.
obviously it's a point of that everybody's talking about in the industry is a silver wave. So by 2030, you're going to have 80 million Americans are going to be 65 and over. They're going to be on Medicare, and then they're going to need some type of service. If it's not senior housing, they're going to need home health, and everything is going towards taking care of the patient in the home, right? So we're one third of the cost versus keeping a patient in the hospital. So if you go for a 3 day stay, with the average length of stay for a patient in a hospital is about 3.5, 3.5 days, we're one third of that cost over a 30-day period, right? So everything is going towards the home, but
And people don't want to stay in hospitals.
they don't want to stay in hospitals, right? But the biggest challenge we have is the government, because for some reason they squeeze us every single every single year. They keep cutting back and they keep cutting back, and I understand because of the fraud that's gone on why they've done what they've done. But at some point, you got to give us a breathing room. You have cost of you have inflation. You have cost of labor that has gone up tremendously. You've had thousands of nurses that have retired, so they're out of the system. Then you have nurses that are now ARMPs, MPs that don't even want to be nurses. So that leaves us in a very, very tough situation when it comes to this labor market. What are the conversations you're hearing out there in the market?
I mean, when it comes to exactly what you said, there's not that many nurses. Kids these days are different. They don't follow the same protocol that we did because we were raised go to school, work hard, study, get a good job. Today, it's a little different. Not many of them are as hard workers as we were trained to be.
Right.
And the school route is not the smartest resort because there's a cooler shortcut that can get them to be millionaires. And I mean, we're seeing a lot of that currently with nurses and medical staff, trained medical staff. No, there is not that many, and everybody's fighting over them. There's a lot of areas that you can't even find a nurse. For
Right.
example, Okeechobee, forget about it. There's probably one nurse there, and she's getting paid 3 times what everybody else is getting paid because she's the only one. So that is a challenge, but there's challenges in everything, and as long as there's a focus, approach, and care behind that challenge, there's always a good outcome.
Absolutely. And I think this is one of the reasons why I think we need to get our message out there, so we can show people the type of company we are. So if you're not happy in the situation that you're currently in, we could be the answer. We can be the solution. And I promise you, we're a great organization. I'm not just saying it. Just talk to the people that have worked here, that have gone through here. We've never burned any bridges with anybody that I can say. Yeah, you've had a couple of disgruntled people that have left. And that's part of running a business at the magnitude that we've been able to run it at. But overall, if you take a percentage, it's a very, very high percentage. I would say it's over 90% that are happy that they came through here because we've treated everybody with class and dignity. And really what we have put first is them, to grow them professionally, but personally as well. We truly care about our people. And John Maxwell talks about this, and you'll always hear me references. People don't care how much you know until they know how much you care. And really, that's a philosophy that we use here at the Roads, that we truly want to care about our people.
That's what made me fall in love with this company, actually, Angie.
Yeah.
Is what we call the Rose culture.
Yep.
And family first, because we're all humans first, workers second. And I think people see that and feel that. And I can speak about my team. Every single person at the very first interview, that's something I mentioned to them. There's no above or below. I'm not above you. You're not below me.
Right.
We're on the same level. I simply have different responsibilities. And that's how you treat me as well. That's how my vice president treats me as well. And that's what I think will make a great team when everybody's in it together and we're servicing the community and ourselves as well at the same time.
What are some of the challenges that you see in the market right now with your account executives in trying to get business and our name out there?
So the market's flooded with home health agencies because anybody can open up a company tomorrow and get Medicare approval, and 80 to 90% of the companies out there chasing the business are Medicare only. Just today we were with a doctor, first words out of his mouth, do you take anything other than Medicare? That goes to show you he's bombarded with companies left and right just with that. So it's flooded with a lot of nonsense, a lot of weak talk or light talk or whatever the expression may be. So when we do come, when the powerhouse does come through, when the people that can actually service do come through, he just thinks we're one of the rest. That's where our challenge and when our duty comes up to explain ourselves, to give them an opportunity to learn more about us and how we differ than, I don't even call it competition, how we differ than the rest. And it's not just on an operational level, it's not just from a clinical level, but it's also from a sales or an account executive level.
Right.
Because we take a lot more care and a lot more involvement with the patient than a lot of the other companies.
So I'm going to give you a little stat. Believe it or not, there's a lot less Medicare certified agencies today than there were 10, 15 years ago. So when I first started in this business, Dade County alone had 1,300 agencies. Okay. So right now, functioning in the state of Florida, you probably have under 100 that are real operational agencies. Okay. I think the biggest problem is the amount of different insurances that patients have right now and with the HMOs. So you don't have the same fee for service you once did. So some of these markets, like Miami's at a 20% free Medicare versus 80% that are all on HMOs. And by county, that number goes up steadily. You know, you have like a 40-60 in Broward, 40% are on free Medicare, 60% are on HMOs. You go to Southwest Florida, it's 60-40 the other way. It's about 60% are on Medicare, 40%. And West Palm Beach is on a 50-50, 60-40, 50-50. So I think that's the shift that you're seeing in the market. And that's why doctors, and a lot of doctors have contracts with these HMO companies because they get paid more.
Correct.
Right. So they have a lot of these type of patients. So I think that's part of it. I think it's a combination of things on why you're seeing what you're seeing, out there in the market.
Everyone's trying to corner the market and everyone's trying to make the money, which is not the right viewpoint and target because we're in it for the patient. Everybody's in it for the patient. And the number one word in medical is patient outcome. Having the best outcomes for the patient is ultimately the best outcomes for the facility and the company. So as long as that's our flagship and our front flag, we will win and we will prevail and we will persevere.
Right. I think it's very, very important because, now we're getting paid for performance, right? And you're getting impacted. And we had a lot of issues during COVID because we lost a lot of nurses to travel nursing, and we were stretched out thin, so it impacted our scores. Now we're bringing them back up. We're at a 4.5 star in Broward, 4.5 star on the West Coast. We're working on the West Palm and the Miami branch, and hopefully we get them up soon. I think they're at 3.5. But
those are backdated scores.
Yeah, they're backdated scores from 2024. But we've done a lot of things now to improve those scores. So I totally agree with you. That outcome is everything that we strive for because it's the only thing we sell, right? Like I tell people all the time, I've been in this business as long as I've been in it. I've never given a dollar to a doctor or to a case manager. I've crossed the line and done anything that's not other than selling our service and providing the best possible. Now, have we had issues with our service? Absolutely. But you need to think about how home health truly works. You get the referral as the account executive. Then it goes to the intake coordinator to the clinical manager that's going to review it, or the DON. Then the executive director reviews it, right? Then they give the approval. Then it goes back to the account executive. And then they give the approval to the case manager, social worker, or the doctor. Then now a nurse has to call the night before. The nurse goes out to see the physical therapy. Like it goes to somebody. There's a lot of hands. And one little thing can set the whole thing off and really ruin you. And you can lose an account over it, right? So there's a lot of things and implications that go into providing service in home care. But I like to tell people all the time is that if there is an issue, we correct it right away and we make sure it doesn't happen again.
And that's why teamwork is very important. And it's one of my primary objectives to have operations and sales be united as one. Because without them, we can't exist. And without us, there is no patients that are coming in. So being united in one is primary objective, and I think a foundation for success and patient outcome, which is the ultimate goal.
100%. And the other thing is, you mentioned operations and sales, and there's always I've seen a lot of organizations over my career is that there's sometimes like a divide, like there's a disconnect.
It's normal.
Yeah, and it's very normal, right? But if you're putting the patient in the forefront, then those two need to come together.
100%.
Right? Because if you put the patient first, then everything aligns after that. And, it's super important. The other thing is that people need to understand with home health is a lot of these patients are lonely. They don't have a family member that's with them 24/7 because they're out working, and we're the only people that they see, and the impact that that has on them. From a lot of these patients are facing anxiety, depression, suicidal thoughts, right? And now we're the beacon of light, a person they get to see on a daily basis or every other day, and now we're impacting them. Their mood's getting better. Now they're recovering a lot faster. They can get back to their activities of daily living. So
I
I would
want to
love your
just
feedback on that.
add a little bit to that. So yes, and it's not just from the clinical staff, because I have family members, friends that are a part of this home health need, where they have nurses that have to come by, take care of them, bathe them, whatever it may be. So that clinical staff member is vital to them. Like you said, maybe their only friend, and that's another way that we differ from the rest. Our account executives, the sales team, they're not sales; they're account executives. And what I like to say is executives of the accounts.
Yep.
They're way more involved with the patient than any other company out there. And I'm very exposed to the other companies. I know what the industry is like. The reps just go, get the business, and operations handles the rest. With our account executives, from the beginning of the welcome call, they introduce themselves, they give their personal cell phone. Hey, I'm here should you need anything, have any questions. It's not a random number. You can call me, text me 24/7, including the weekends. And when they say it, they mean it. And I think that's another reason why we stand above the rest and why we can shine and be the cream on top.
Absolutely. So I know we have some open spots in West Palm. What is it exactly that you're looking for in an account executive? What type of account executive are you looking for? What are the characteristics that you're looking for? Do they need to have experience? Like, lay it out there for the people watching this, because they're probably not going to watch the long form podcast, but we are going to clip this up. So tell me what it is exactly your ideal account executive, because we're actively looking for account executives that want to come work and that are hungry and that want to have a career change or create a career for themselves.
So I've learned my lesson. Before it was a lot of what does the resume say and how powerful does the resume seem? And you get those people when they start, they're just not hard workers or they don't have the personality. So what I've learned is I genuinely don't care about resumes anymore. I don't care if you went to college or not anymore. What you really need is primarily to be a people person, be a hard worker, and be down to earth again. Be human first.
Right.
Know what we're here to do and who you're ultimately here to serve. And if you come with your heart placed forward and with the right mindset on what your job and responsibility is, you're not just checking off boxes of what are my duties as an account executive, check box 1, check box 2, check box 3. That's not the job. You have one check mark box. Serve. We're here to serve the community and the patients and the doctors. What are we? We're an extension of their practice. We're here to alleviate their job when it comes to, hey, I need to place somebody. And you said it best before. What happens when we can't place that patient? What happens when we do receive a referral, someone in need, and we can't place them, whether it's clinical, whether it's insurance based? Well, that's our time to shine.
Absolutely.
We're the experts in the industry. We know who can take them and can't take them. Let's alleviate that pressure for the accounts, for the case managers, and find them a home. And the patient.
Absolutely. I mean, you're dead on. I listen. I wouldn't be here today without the opportunity of being an account executive. I did it for many years, and I did it at a very high level. And I was very lucky. I have to say that I got mentored by some really good people in this business and taught me how to do things the right way. It was a very challenging business. There was times that I wanted to quit. I'm not gonna lie, because it was a very challenging business, but I stuck with it. And today I look back and I'm like, wow, thank God that I stuck with it, because we've been able to impact so many lives. B, hire so many people that have come through here, and that's what's given me a lot of joy, is to see the growth that people have had in this organization. But really, what gives me the most joy is the impact that we have on these families on a daily basis, that we're providing something that they truly need. So this is why it's important to come on these type of platforms and let people know who we are, what home health is, because sometimes patients end up in the hospital. They're a fine 65-year-old or 70-year-old. They've never had a problem. All of a sudden, they had a father in the hospital, and now they're dealing with having to make a decision. And now they hear about home health for the first time, and they have no idea. The family member's dealing with it. The son, the daughter is dealing with it. They have no information. They have no idea. So I think the purpose of creating this podcast is to get the information out there and to start educating. We're going to do more things on education. I have the assisted living podcast that we're doing a lot of educational pieces on assisted living, but I also want to start doing it on the home health side because it's such a vital, important part to the recovery process for these patients.
Exposure and education.
Absolutely. Absolutely. So, Ruben, in closing here, you have any closing words?
Home health is not going anywhere.
Yep.
The patients are going to need us regardless, and we're looking for the best of the best to help us serve that community and that need. Absolutely,
man. We'll do it again, definitely. Check us out, subscribe, like, share, comment. Any questions that you have on home health, please DM us. We're on Instagram. We're going to be on YouTube. So anyways, we'll catch you guys on the next one, but thank you for tuning in, and hopefully we can bring a lot of value and impact for you guys. Thank you.